Thank you very much. Hello to all of you from all around the world. That's incredible. So today we're going to talk about the business model and profitability of prophylaxis during COVID-19. We heard a lot of things about the profitability of the prophylaxis and how we're going to manage the patients now. But first, I'm going to introduce myself. I'm Celso Da Costa. I'm a Portuguese dental hygienist since 2010, and I've been working in Switzerland since 2011. Since 2017, I started a career as prophylaxis manager for a big group of clinics, 24 clinics in Switzerland, and I also obtained my diploma in management and human resources. I'm also an SDA trainer. So, before starting with the economical side during the COVID-19 situation, we need to look a little bit for the past and see what were the dental practice biggest problems before COVID-19. And it was always patient loyalty, because you need the patient to trust you to come to the clinic, the downtime in the schedules, the cancellations, the failure to attend, and gaps that is really damaged for the business side of prophylaxis and the clinic and the dental practice in general. Bringing new patients to the practice, it's not easy. Standard protocols, implemented standard protocols in a group of clinics like the one where I worked, where we had 24 clinics, is always hard work. Get the teamwork, the staff turnover, the continuous training, increase profit, that's why we are in the business, and keep or increase the quality. And just to have the solution for all these problems, in our group, we started to thinking about prophylaxis as a key element, as the center of the treatment for the patients. But not only the traditional way of visits, but the GBT hygiene visit, the guided biofilm therapy provided by EMS and used with their devices, with the airflow prophylaxis master. And this just changed the consultation and the experience of the patient a lot, because in traditional hygiene visits, we had only 60% of meet and greet, 70% of debridement, and then at the end, we got to the oral hygiene instruction. Now with GBT, we have 8 steps. The first one is assessment. So we are talking with the patient, asking what the patient expects from us, the health questionnaire, and also just getting periodontal measures. We do the disclosure with the disclosure solutions to see what are the problematic areas in the mouth of the patient, but also to show the patient the areas that they need to improve and why they need to improve, because some of them don't see the biofilm. Then we start immediately with motivation. After the motivation, we get the airflow as the first element of the debridement, the perio-flow, the piezo. We check up if we got something, if we got passed by something, and at the end we call where we give a strong reason to the patient to return. So this kind of way, we have 41% of consultation where we talk a lot with the patient. We explain why they need to improve the oral health, and that the oral health is really an important step to provide a good health in general. So we implemented the GBT protocol in 2017. In 2017, you can see my schedule. I work only 50% as a dental hygienist because I'm prophylaxis manager, the other 50%. And you see a lot of gaps, a lot of appointments 1 hour, some fails to attend, like you see in red. Since we implemented the GBT protocol in 2019, also in November, the same amount of time, you see that the schedules are full. The only gaps that you see is 15 minutes gaps that I use for my periodontal patients. This means the patient that I have seen 2 weeks ago, I fix them only 15 minutes to see if they are healing well or if we need to improve something in the oral hygiene. That's why we are seeing this 15 minutes gap. But otherwise, now I'm seeing the patients 45 minutes. Why? Because the most of them are only follow-up patients. They don't have any problem. They just came every 3, 4, or 6 months to do the prophylaxis maintenance. So we saw that through GBT, through guided biofilm therapy, we got a planning optimization, but also the trust of the patient. Like I said, most of the patients, they are leaving already with an appointment, and it's just patients that I know for years and years already. And they keep coming and they ask for the GBT. These have an impact directly in the direct revenue. So this is me as 50%. You can see 2017, I was in the average of 800 francs per day. And since we established GBT as the standard protocol for prophylaxis, every single year we are getting a step higher and increasing the direct revenue, the fees per day. Now, in 2020, January and February, we were between 1,400 francs and 1,600 francs. This is really impressive. It's almost the double of the fees that I got in 2017. Why? Because this is a snowball. Patients come to the clinic, they like the GBT and this workflow that we have now. They don't feel any pain, and they're gonna advocate for us for other people. They leave with the next appointment, and they're gonna bring new patients to our practice. Okay, this worked for me. Let's see other dental hygienists. I have in the left side one dental hygienist with more than 20 years of experience. You can see the same thing. The curve is beautiful. She is increasing every single time. And you have on the right side of your screen a dental hygienist with less than 4 years of experience. She started with us in 2017, then she got pregnant. That's why we have a gap from October till July till April of 2018. And then we provide the device and the training about the device, the airflow prophylaxis master from AMS, and the training for guided biofilm therapy in August. You can see that the increase of the direct revenue is not, okay, I got the machine today, I'm going to start GBT today, tomorrow I'm going to increase the fees. No, that's not the thing. We're going to see improvements 3 to 6 months after. Why? Because it's when the patient's going to return again, and they're going to bring new patients. So like I said, it's a snowball effect. The patients that we saw, we're gonna keep them in the practice, and they're gonna bring new ones, and then we're gonna just increase the list of patients. So the numbers balance, if I see in the general way with the 24 clinics, we can see that since the end of 2016, knowing that we put in place the program with GBT in 2017, till the end of 2019, we saw an increase of the direct revenue of 85%. We went from less than 4 million to a little bit more than 7 million in 3 years. So for me, this is amazing. And this is the Pareto rule right here, where we're saying, okay, do 20% of the effort, you're gonna get 80% of the results. Here in the practice, we just play with prophylaxis to bring the practice to another level. And again, I'm just talking about the direct revenue, but we're gonna get in some more details in this presentation. So we saw the problems in the past with the dental practice. We know that we can solve these problems with a good prophylaxis department and also with the GBT. But now, what are the biggest problems during the COVID-19 situation? Honestly, we have the same problems, but the one that's gonna stand out the most gonna be patient loyalty. Why? Because we have the challenge now that we need to rebuild this trust and remove the high level of anxiety of the patients. Maybe they are afraid of coming to the dental practice now. So what we need to do, just what we were already doing in the past. Because by changing from the traditional visit to the GBT hygiene visit, we saw that we have a lot more time to discuss with the patient, but we are showing the patient the reason why we are doing prophylaxis. And this is patient engagement. So we already engage with the patient to tell them why they need to come to keep a good oral health, and how this oral health going to improve their general health. And this is only in 4 simple steps. The first one with the assessment, like I said, we're going to talk with the patient, we're going to see the patient as the individual and adapt our treatment for this patient by the questionnaire. With the disclosure, we are doing the same thing. Maybe the first patient, I'm going to do the disclosure and I'm going to see that, okay, it's the wrong toothbrush technique that he's using. So I need to improve the toothbrush technique. With the other one, with the periodontal patient that I'm going to do the disclosure solution, maybe it's going to be the interdental brush. We're going to adapt with this workflow. And by adapting, the patient going to understand and they're going to improve the results. Then we start with the motivation. Again, we are getting individual advice. It's really an experience and it's personalized for this patient. And at the end, you have the step 8, the recall, where we're gonna get a resume of everything that you talk about in the appointment, but also giving the strong reason why the patient is coming again to prophylaxis, why they need to do it, and give an exact date to the patient. Like that, I can assure you, they're gonna keep coming. So this new concept, it's an experience itself. You can interact it with the kids, and they're gonna feel it like an interactive choice where they're gonna talk with you, and we're gonna improve directly in the mouth of the patient how to use the right toothbrush technique, for example. We can use it in orthodontics, and I'm gonna give you an example a little bit further in this presentation, how to interact GBT with the orthodontics, for example. And you know pretty well, these kind of patients, they need a constant reminder about oral hygiene. Otherwise, the treatments at the end of the treatment going to be really hard, because they're going to have dental caries, they're going to have sometimes periodontal disease, they're going to have white stains. So we need to keep an eye in these kind of patients. And then the patients that I enjoy the most is this kind of difficult patients. This one in particular for me is a joy to show the case, because I started to see this patient. It's been 5 to 6 years. I don't remember exactly, but every single time it was hard because she kept coming with a bad oral hygiene. And since 2017, we have done the GBT protocol, and just this simple step of doing the disclose, the personalized motivation, and start with the airflow, it changed this patient forever. Because even if the first photo, you can see the biofilm and the calculus, it's not clear for the patient. And once I got the disclosure, she was a little bit afraid of my speech, but she understood why we were doing what we are doing, the prophylaxis. And then 3 to 6 months after, she came back again with these gums. They are perfect. I'm looking for it, and we need to look twice just to understand if it's the same person. It's the same person, but she understood with this workflow, with this guided biofilm therapy, because we are getting the experience of the patient, starting in the lowest level and reach the peak after the motivation. And then we're going to do just standard debridement with the airflow, starting always with the airflow. Why? Because we're going to remove early calculus, biofilm, stains. It's less painful for the patient, and then we're going to use only the piezo in the areas that we need to use for the hard calculus. So the patient going to feel this difference, and they're going to feel comfortable too. And this is what I'm talking about. Is with guided biofilm therapy, you are providing a new experience, but because the patient is part of the treatment, the solution is in the patient. So in the periodontal patients, you can do the best work ever. If we don't teach people to do proper oral hygiene at home, it doesn't matter. You're gonna keep evoluting in the periodontal disease. But if we change the communication and if you make the patient part of the solution, you're gonna have the click and you're gonna start working at home too. And let's be honest, in the society where we live on now, most of us only want to experience things. We don't have material things. We want to have experience. I enjoy a trip to Bali more than getting a painting of Bali, for example. And with millennials, we are learning about this because in a lot of studies, we see that 72% of the people, they enjoy more the experience than they enjoy material things. And with GBT, we can provide this experience. We are not only providing a service, we are providing a really good experience. Okay, talking about the COVID-19, we know that the situation evolves. We have new workflows on the clinics. We suppress the waiting rooms. We have a little bit less contact with the patients. Why? Because yeah, we're not gonna get the patients to the waiting room. They're gonna come directly for the dental office, for example. We have the guidelines from the MS. These are really well done document about COVID-19 and aerosols in dentistry, how to reduce the aerosols. Let's be honest, since dentistry is something, we have aerosols. The good thing about it is that we need to know how to control these aerosols, but we also need to properly inform the patients. Don't be afraid, because the laws in dental practice, they are really, really strict. And if I'm gonna be honest with you, you're gonna say, what have you changed in the disinfection? Disinfection, nothing. I just spend more time because I need to open the window to renew the air, and I need to change the PPE, and I have a lot of PPE now. But the disinfection, since the beginning, it was really, really strict, and we already were using the right products. So now the difference is the PPE. We are the gowns, we have the hair caps, we are using FFP2 masks, so N95 in North America. The FFP2 masks, we keep the mask for 4 to 6 hours, and we keep another surgical mask that we change for every patient. We have now the face shield, but honestly, this is not new. Since the beginning, we are saying we need to use face shields. I use the loops with the face shield. We 3D printed the face shields, so now we have space for the loops. But again, in long terms, for me, the only thing that's gonna change is the mask. I think FFP2 is gonna be the standard for the future, and the disinfection time, because we need to renew the air of the room. Then we, like I said, we have the gowns, but we have a plastic apron that we change for every patient too. Most important, just control the aerosols, and that's gonna be with the Optrograde, because you can just contain the aerosols a little bit, but it's gonna be more practical for us to move around with the high vacuum system ejector. Always use the low vacuum ejector and the high vacuum ejector with the correct technique and the correct device settings. But you had Faye today that talked really, really well about it, and you had Marcel also this morning. And we can see in the articles that we can reduce in 94 till 98% of aerosols just by using the high vacuum ejector. So once again, in dentistry, we were really, really strict since the beginning. But now the schedule gonna change with these disinfection rules, disinfection concerns. So like we saw before in 2017, I had a schedule with a lot of appointments, 1 hour, with a lot of gaps and some fails to attend. 2019, the schedule, it was really, really nice because we were already using the GBT for a while. So we have a plan optimization, but also the trust of the patients. And now with COVID-19, the only change is that in between each patient, we have 50 minutes. Again, it's not the surface that we are disinfecting more. Now since the beginning, we were disinfecting all the room in between patients, but now we open the windows to renew the air for 50 minutes, and we need time to remove all the PPE and get the new ones. But this is going to be an impact in the economical side. That's why I'm talking about the different schedules. So 2017, 2016, we didn't use GBT. I had 1,324 consultations. 2017, we started integrating the GBT technique. So I have 1,326 consultations. Not the difference. While, like I said, the GBT, it takes 4 to 6 months to develop itself and to bring some results. And the results we saw in 2018 and 2019. You can see 2018, I had 300 more consultations. That's huge in a year, having 300 more. And in 2019, we already improved a little bit more, 1,796 consultations. We got the results of the GBT and by using this new workflow. So now with COVID-19, we can have a lot of difference, mostly in the fees per day. 2017, you saw my fee per day, it was 850 francs. It wasn't good. We had a lot of fail to attend, a lot of gaps, a lot of long appointments that there were no reason for. 2019, 1,400 francs. We saw it was a little bit higher, but yeah, we're gonna say 100 and 400 francs, a good increasement. Now during COVID-19, we're gonna have a lower income. Why? Because we're getting this disinfection time in between each patient, so we are seeing 2 to 3 patients less than usual. But the thing is, we are using more PPE. You are using more time to disinfection. So here, we charge now a disinfection tax of 15 francs for the patient, and it's gonna balance it. Number of patients, 2017 I had 24 patients, 2019 36 patients in a 50% schedule, and now with COVID situation 26. So it's 2 more than 2017, but it's 10 less from 2019. That's a lot, but we don't see, we are seeing that the fees per day are higher during the COVID-19 than it was in 2017. Why? The schedules, they are fully booked. We are fully booked for the next 6 months. We had already 3 months of waiting list. Now we have 6 months because we are seeing less patients a day, but the patients want to keep coming. We opened the clinics the 27th of April. We were a little bit afraid. We got this engagement with the patients. I was confident, but yeah, nervous. Since the beginning, we are fully booked. And the patients keep calling and asking for the GBT and asking for their dental hygienist. Why? Because they know why they are doing it. They know that it's important to establish a good oral health, but also a general health. And the fees per hour, if we compare, 2017, it was 106 francs an hour, 2019, 175 francs an hour, and now we are a little bit lower than 2019, but way higher than 2017 because we are 143 Swiss francs an hour. And let's be clear, I'm not counting the dental x-rays, I'm not counting the whitening, I'm not counting the dental sealings, the laser, you name it, it's just standard prophylaxis. Even periodontal disease, I'm not getting here the treatment. I'm just talking about the standard prophylaxis. So this is really good. Patient trusts us. The schedules are full for the next month. Like I said, they want an appointment with you. They call the clinic and they ask directly for their dental agendas because they understood the importance of oral health in their general health. The numbers balance, like we saw, I was a little bit higher than 1,400 francs. Now in May, I have 1,150 francs of average. Yesterday I was in the clinic, so it went a little bit more higher. But this is explained because we are getting more time between patients and we are seeing 2 to 3 less patients a day. And of course, we are spending more money in PPE. In general, we are spending 5 francs more in PPE, but we are charging the 15 francs tax charge. So it's going to balance the things up. We can see that when we focus on a delivery model that is geared towards our patients' health, we are now also building a patient base that are loyal to us regardless of competition. The patients, they are staying with the guided biofilm therapy and bringing new ones. So they are referring new ones. They are accepting better the treatment plans, not only from the dental hygienist with the periodontal treatment plan, but also the specialists, because now they engage and they trust fully the dental practice through prophylaxis. And they are just feeling well in general. Okay, we saw the direct revenue. And you saw that, okay, it's gonna get lower with this COVID-19 situation, but not so much. We are established a good feed per day, even with COVID-19 situation. But how is important, how prophylaxis is important in the dental practice? Really, is only the direct revenue? No, it's not. It's the patient flow, the most important that prophylaxis can bring to the dental practice, because the patients keep coming every 3 to 6 months. We have a continuous contact with the patients, so we are engaging always with the patient. We are improving treatment plan acceptance, like we said. We are improving the image of the dental practice by having a really performer, but also quality-oriented and center on the patient prophylaxis, and the publicity, patient to patient, because they are bringing the new patients like this. Most of all, the possibility to find new treatments to do. That's where I was coming for. Well, we don't have only the direct revenue of the prophylaxis of the dental hygiene department. We also have this important side of it, the indirect revenue. This means the downtime in the dental hygiene schedule, or if we don't open a dental hygiene schedule, or if we don't perform well in the dental hygiene department, the dentist is going to miss some opportunities. Why? Because when we have the patient flow and we are bringing the patients to the dental practice, we're going to be more aware, and we're gonna just diagnose new cases of periodontal disease. For example, we're going to see some broken teeth. We're going to see some caries to treat. We're going to advise patients to do some dental implants where they are have a missing tooth, for example. So this is really important, and the impact is huge. Here we have a case study of one clinic that had a 10% of downtime on their hygiene department in this clinic. So this was 168 patients that weren't coming to the dental hygienist. So if we count only these 168 patients, if we say, okay, 1 in 2 needed a checkup, we have a missed opportunity of 6,300 francs. 1 in 2 need a bite wing, we are missing 3,000. 1 in 4 need a minor restorative treatment, we are missing 9,000. 1 in 30 need a dental implant, 7,000. And 1 in 3 needed periodontal treatment, because we say in between 25 to 40% of the patients, they are periodontal patients. So this is 67,000. If you add all of this, the indirect revenue lost, the dentist missed opportunities, is gonna add up and just get to 104,000 Swiss francs. Don't forget, I'm not counting the orthodontic treatments that we can send to the orthodontist, the crowns and veneers, the removal prosthetics, and so on. I'm just talking about 5 simple procedures: checkup, bite wings, minor restorative treatments, dental implants, and periodontal disease. So in these 5, we already have a missed opportunity of 104,000 Swiss francs. That's a lot. And this can do or break the dental practice. We are accepting 5% of downtime. Now we have only 4% since we start doing the GBT. Like I said, this is a communication. The workflow with the GBT, with the 8 steps, you're gonna improve. And it's a standard protocol that is really easy to adapt to the practice and to use it in interacting with other specialists. Even more impressive is, okay, you are saying you have the direct revenue. It's in a ratio 1 dental hygienist for 1 dentist. We are having 30% of the direct revenue of the whole clinic came from the dental hygiene department. But the most interesting part is that 64% of all works done by the dentist, they are provided by the dental hygienist. So we don't only have 1 finger on the indirect revenue, we have the 2 hands fully on the indirect revenue, because 64% of this 70%, it's just indirect revenue. So the prophylaxis system is really department is really important for the as a practice builder, but also to maintain a good financial health in the practice. And even during COVID-19, I heard a lot of dentists saying, okay, I'm going to avoid the dental hygienist in the practice because it's generating too much aerosols. So for now, I'm not doing. In 2-3 months, they're going to get the schedules just empty, because the dental hygienists are providing these patients to the dentists. And we had cases in the past where I got 2 sick dental hygienists. So for 2 months, I didn't have a prophylaxis department. 2-3 months after, the schedules of the dentists, they were filled to 40% only. So we have a really good impact. And it's important to do it properly. So we are seeing the importance of interaction and teamwork. And then, like I said, since the beginning of this presentation, it's really easy to integrate GBT with all the clinic specialists. We can integrate it with the pediatric dentistry, with the orthodontist, and I'm going to give you an example, with the periodontists, with the implants, and the implants is really important to do it with GBT properly. The patients spend a lot of money. They lost their teeth. There was a reason, so we need to be more aware of the implants. And we know we have a tsunami of mucositis and periimplantitis. They're gonna come. They're gonna come. So start with the airflow, perio flow, and then the PI insert to the neck of the implant. So this is an example how to interact GBT with orthodontic treatment. So before getting the braces on, the patient came to the dental hygienist to do full GBT before getting the braces on. 2-3 days after, you're gonna come, and in the same day, they're gonna get the braces, and 50 minutes after, they're gonna come to the dental hygienist just so we can show them how to properly do the oral hygiene with the braces, because it's different. With no braces, it's one way. With braces, it's gonna be another one. And like this, we have a really teamwork, but also a good, we are following the patient through the whole treatment. And then this kind of patients, they keep coming every 3 months. Then here we have a really good example of a bad oral hygiene during the orthodontic treatment. Then before removing the braces, in the same day, in the same, almost the same appointment, we do 30 minutes of GBT before getting the braces off. We remove the braces with the orthodontist, and after removing the braces, again, 30 minutes of GBT, because it's been 1 year, 2 years that patients were missing some spots with the braces. So we do like this, and we maintain a good quality, of course. So with a good prophylaxis department, we are not only increasing the direct revenue of the dental hygiene department, but also increasing the indirect revenue. and we are filling up the dentist and specialist schedule. The prophylaxis is really, really important, like I said, for the patient flow. And since we are using GBT, 85% of all our patients, they are leaving with the second appointment. So we are already filling the appointments for the next 3, for the next 6 months. And like that, we have less downtime. That's why we are getting the downtime at 4% only. Patient keep coming because it's an open treatment. It's centered on the patient. We have personalized advices because we are doing the disclosure solution, so we can really adapt our speech and adapt the techniques to the patient. We are giving our patients a strong reason to return. In the recall, give the exact date. Like that, the patient gonna keep in mind, and they're gonna make the appointment. We are just adding the patient's unique motivation, and it's a really powerful element. Like I showed you before, with a good prophylaxis department, we are retaining the patients. Patients are accepting the treatment plans, not only periodontal concern, but also other ones like orthodontics, like implants, like veneers, because they ask for our advice. They are referring new ones. I have a lot of full families. They bring everyone. They bring the dad, the mom, the children, the uncle, you name it. Some of the days I'm fully booked with only one family, and the patients are well. And with this, I want to show you that prophylaxis is really, really important to a good restart of the dental practice, mostly now with this COVID-19 situation. But I want to show you that if we work well, if we are well prepared, if we are thinking about the patient and adapting with the guided biofilm therapy to provide a new experience to the patient, we're gonna flourish, and like we're gonna grow a lot. Just keep in mind why these escape games, they develop it so well, because they are providing different experience, and they are interacting with people. And with GBT, we can do the same. We are providing a different experience. It's not the same that they had 20 years ago with the dentist. No, they came in, they are part of the solution with this kind of technique. And good news for us, because people want to focus more on their health. And we have the Boston Consulting Group that have just done some surveys around the world. And honestly, people are expecting to spend more money in the next 6 months in preventive healthcare. And prophylaxis, what is prophylaxis? It's preventive oral health. And by preventing oral health, and you saw by the excellent presentation from Dr. Victoria Sampson, it's connected. Poor oral hygiene is connected with the COVID-19 situation, because we had a lot of articles, a lot of studies in the past correlating bad oral hygiene with cardiovascular disease, with Parkinson, with diabetes. So it's important to establish a good oral health to prevent general health issues. And we can see in these 5 countries, we have China, the first epicenter, Italy, the second epicenter, and now the States, that we can consider the third one. And all of them in the first place, second place for the States, and third place for France, they are getting preventive healthcare as their main focus to spend more money in the next 6 months. So this is really a good opportunity to us. We're going to be recognized by this, and we can grow a lot more because we are providing a quality treatment for the patient, and we are providing with GBT minimally invasive way of doing prophylaxis, but also with this educational part where we're going to teach the patients, and they're going to interact with us, and they're going to be part of the treatment. So prophylaxis is the key for a smart restart in our practice. Why? We are providing best treatment quality. we are doing the assessment for everyone, so there's less underdiagnosed periodontal disease. We are empowering dental hygienists because they have a hand on this business, and they are sending more patients for the dentists with treatments to do. And the teamwork, this is providing teamwork, and this is a standard protocol, pretty easy to use, that we can use with everyone. It's the best practice builder. We are increasing the hygiene direct and also the indirect revenue. While we are bringing new patients, we are keeping the old ones, we are decreasing the downtime, we are increasing the referrals, and increasing the dental treatments enrolled through dental hygiene. And honestly, the third point, we're just providing the prevention for the patient. You are contribute to for good oral and general health. So this is some of my photos. This one we already seen. For me, it's really beautiful to get this kind of results. But I have another case. This is for us. Okay, we can see the biofilm, we can see the calculus, but not the patient. And I was seeing this patient for 2 years already. It was really difficult to motivate them. And just by doing the disclosure and by using GBT and showing how I was removing the disclosure with the GBT, because I got a mirror for this patient, then 3 months, 6 months after, we got these results. It's not perfect, but it's a good improvement. And you have to admit it. It's a good improvement in the patient oral health. So thank you so much. If you have questions, I'm going to be available to answer you. And you also have my social media from Instagram, where you can ask me everything you want.
Thank you very much, Celso. It was very interesting, very inspiring presentation, definitely.
Yeah. I tried to do it in 45 minutes. Normally it takes me an hour to do it. I have done it in the 44 minutes. So I think it's a good result for me.
Definitely very good result. We have few questions, and I actually wanted to start by asking you. So definitely the GBT is incredible technique. Do you actually think that how important now becomes the hygienist in communicating this new option for the patients? Do you think, of course, I mean, the protocol talks by itself, that's for sure, but do you think that the hygienist should actually take a lot of care also in the communication process to make sure that this protocol is actually...
One of the things that we were really careful when we were starting with GBT in our practice, it was how to communicate with the patients, because we were changing from hand instruments, and now we are saying, okay, we're going to use the airflow. It's more efficient, more comfortable for you, and we have better results. And the patients don't feel anything, and they are used to feel really pain during the end instruments and this pressure, and now they don't feel this pressure anymore. So we need to... I always make the comparison with the wheel. We started with a stone wheel, then we changed for a wooden one, and now we have a rubber wheel because it's more comfortable, more efficient. And the toothbrush is the same. We started with some roots of some plants, and now we have electric sonic toothbrush are more efficient and better for the patient. And honestly, like you said, the protocol speaks for itself, because it's a 8 steps wheel where you're gonna do step by step and interact with the patient. Just the first step is to know your patient, like what they are expecting from us, to do the health questionnaire, to do the assessment and see where we have periodontal pockets, for example, where we have in the mouth. Then you're gonna start with the motivation already. What you have in the mouth, just get the disclosure, work with it, and adapt to the patient. And that's what people want now. It's the experience and get some personalized care, not the same thing every time. And I have patients that 1 year I have just done everything, airflow, perioflow, and ultrasounds, piezo, and now they are coming and I'm doing the airflow and I don't have anything more to do. And for me, it's gratifying because, okay, I impact the life of this patient, and I make a difference also. So that's, like you said, the protocol speaks for itself. And once you're starting to know your patient at the beginning of the appointment, spending more time adapting to the patient, and then do the treatment, the patient is going to understand. And that's the communication. The communication is not only words, but also some body language. And you have this
Empathy.
body language with the LGBT.
Also a lot of empathy, definitely. Something that you cannot really teach, you can explain, but some people makes it out of the box, basically. So a very interesting question here. How do you explain the change of therapy to the patients?
From the end instruments for GBT, for example?
It was probably a problem of the past, very likely, but...
we have a really good example that I started also with some of the patients. When they have their car and they want to wash their car, if they're gonna do with a hard toothbrush manually, they're gonna just ruin the paint job of the car. But now they are using car share because it's more efficient and doesn't damage the painting. And like I say to the patients, if I'm doing hand instruments all the time, even in places that I don't have calculus, but I need to go deep to see if you have it or not, I'm just removing hard tissue, and this hard tissue doesn't come back. So in my ethical opinion, I cannot provide a treatment that is removing calculus, but also creating some damage in their teeth. And by GBT is a minimally invasive way. It's comfortable for the patient, but also for the clinician, and I'm not damaged the enamel, for example. So this is a good point and a valid one, and people understand this.
I guess that they will see it as an evolution, definitely. So sort of.
And they see the results. You know, the first patient that they came for the second appointment, they say, "Please, can you do the blue thing again, just to see if I'm better now?" So this is a form of communication, because they're asking us to see if they have some results or not.
For kids, what age do you start GBT with?
What age I start with
for
GBT?
Kids.
For kids, honestly, the youngest one that I had, I think he was 3 years old.
Wow.
Yeah, you can use for everyone. And the patients enjoy it because it's interactive. They're gonna see the violet thing for the disclosure, and they're gonna play with it. And then when you have families, it happened a lot with me. I had 3 brothers, and they're gonna interact, seeing which is the best, you know,
challenging,
which is the worst with the disclosure. And then, okay, this time I win. Oh yeah, you smell. No, it's funny. It's funny with the kids. It's funny because we have the mirror and we are interacting with them, and they want this. They don't want to be afraid of the dentist or the dental hygienist. They want to come and feel comfortable with us. And with GBT, you can provide this because you start for just to discuss, to show what they have, show how to improve, and then start with the airflow that is minimally invasive and the patient doesn't feel anything.
What kind of toothbrush do you highly recommend to your patients, manually or electronic?
It depends of the patient, honestly. It depends of the patient. Sometimes we start with a manual toothbrush. For example, patients that really had an implant done, I'm not gonna say to get an electric toothbrush. I always do some soft manual toothbrush because they can do the gesture and they can adapt around the implant. For example, for the smokers, sometimes electric or Sonicare. It depends of the mouth of the patient. Again, we cannot establish a guideline and use the same thing for everyone. We need to adapt, and we're gonna adapt by doing the disclosure, seeing what is the possibilities and what is the needs of the patient.
So we basically have answered. The only question I'm not sure to understand it completely is, does the system, the charts you show in the terms of incomes and all the revenues, does the system include patients that are on lower incomes or only patients with private plans and good resources? I think it was about all the patients of your study, of your office, I guess.
Yeah, the things that I have done is all the patients.
All honestly. The patients.
It's not
generally.
Only the higher or it's the same. The price is the same for everyone.
Exactly.
So, yeah. It's all the patients.
One question is really like, because I want to hear how you answer this, is really from my point of view. What do you absolutely would miss from the GBT system to go back to the old system? What is the worst thing that you would have to be forced to be used? Is it correct?
Yeah, for me it's mandatory using the airflow. Honestly, they cannot. I will be dead before they take the
away
airflow
my
from
airflow.
Me. Yeah, I'm gonna be buried with my airflow. No, honestly, it's so practical, and we see the difference. And honestly, the first year that I started as a dental hygienist, I felt some pains in my arms and back. Then I start changing the ergonomical side, doing more piezo, wearing loops, doing some workout for the back. And then when I got the solution of GBT, I don't feel anything, honestly. I can do 13, 15 patients a day, and I don't feel any pain at all. So, because you spend less time in the mouth of the patient, you spend more time talking with the patient now. And you can do the work in half of the time with the airflow, periflow, and piezo. So, for me, please do not remove my airflow. No.
Thank you very much, Celso, for this beautiful presentation again. Thank you for having been with us. And
Thank you.
we hope to see some of your webinars soon again, definitely, because they were very inspiring, absolutely. Okay,
Yeah,
so...
Okay, if you have any question, I'm always available. And stay around because Magda gonna have a really beautiful topic.
Yes, next speaker, exactly. Next speaker up is Professor Magda Menzi. We're going to take a short break.